Welcome back. According to the Health Department, in 2011, 94,000 girls aged 15 to 24 fell pregnant in South Africa. That's more than 2,300 classrooms full of pregnant girls. The HIV prevalence in that age group is 21%. In India, it's less than 1%. Aid workers in South Africa are now looking to Kenya for solutions.
The teenage pregnancy was very high amongst adolescents.
In Kenya?
Yes, and they decided to take a decision that we need to address this, and how do we address this.
And they've done well?
Yes, they've done well.
And we're copying from them now?
As an African country, I think we can copy from our African colleagues.
Youth specialist Hilda Moringa says South Africa is now implementing Kenya's Families Matter program, which she says produced phenomenal results in the East African country.
Actually takes the parents step by step on the reproductive health issues. You know, things like sexual transmitted infections, they are taught. How transmission of HIV and AIDS is done. Even gender issues, they are addressed, you know, to encourage parent, like a female parent, to be able to communicate with the boy child, you know, so all that information is shared with the parents.
In Kenya, we have been rolling them out in the last 7 or so years, and we have reports from schools indicating marked improvements in communication between parents and their young people. Now, the beauty also with this Families Matter program is the parent that has had an opportunity to receive this communication skills program has the advantage of discussing sexuality, not just with their own child, but with any other child within whom they have access to. That could be the neighbor, it could be the niece and the nephews. So it's more than just a parent, it's families. And you know, with our African context, the family is a really broad scope of a parenting arena. Looking at, for instance, the Kenya AIDS Indicator Survey, 3.5% of women between the ages of 15 and 19 are HIV infected.
They do have high stats, but they're actually lower than South Africa because they have already packaged their programs. For an example, with youth, you need to package programs for adolescent, pre-adolescent, adolescent, and youth, because the messages should not be the same.
So are you saying Kenya's prevention mechanisms are better than those here in South Africa?
To be honest, they are far ahead.
Education is an important factor because less educated women, young women, tend to engage in sex much more.
Most of the times when you compare the studies that have been done, you find that the problems that they're having at Kenya is the same problems that we're having here in South Africa. The other problem that is actually surfacing now, it's drugs and alcohol abuse, which we are not doing much as a country to try and address those, because honestly, if somebody is drunk, do you think of a condom? If you're under the influence of drugs, do you think of a condom? No, you don't.
We prepare our children about the careers that they will come across, about their school education. Similarly, we need to get a child prepared to understand what's coming in terms of their sexuality.
UNICEF estimates that some 14 million children around the world are born to other children. Teenage mothers are more likely to drop out of school, be unemployed, and suffer from depression. It's up to governments to create conditions that will make them feel they have more to live for, and up to us who are older and wiser to help them identify opportunities that will convince them to delay sex. I'm Nkepilima. We say thanks for watching Outside Eye, your global perspective on South Africa in 15 minutes.
News that moves. ENCA.com.